I definitely opened the door. I was the first person to see him. We were there when other people arrived, and we did not lock the door again.
I just know I had to unlock that shower door, and that haunts me to this day.
The words of two healthcare staff, both claiming to have opened a locked bathroom door to discover Richard Wade strangled with a dressing gown cord. These contradictory accounts suggest the door to the room where Richard lay unconscious had to be unlocked twice. It begs the question, was he abandoned for a brief but critical period of time as he lay in desperate need of resuscitation? It's a thought that tortures his parents because they witnessed the moment he was found and watched the horror unfold.
I remember turning around and saying, I hope that that's not my son.
I could only see his legs, but you recognise your own son, and that is what I saw at that point.
This was his sixth form.
Richard was a high achiever. By the age of 30, he'd got a PhD and a job in the city.
This is the book that he actually wrote and had published after his PhD.
So he was a published author?
Yes.
In his early 20s, he had suffered a mental health crisis, and in 2015 his anxiety resurfaced and he became extremely agitated and suicidal. Richard was admitted to the Linden Centre just before midnight on May the 16th. But after reading online reviews of the unit the next morning, Linda and Robert decided to remove their son immediately. They arrived at midday, just 12 hours after Richard had been admitted, and were led straight to the ward corridor.
Let's take a look at the floor plan. So we're standing in this area with a view down the corridor to Richard's room and the shower room, which is where he was found.
All the staff present that day were questioned as part of an internal investigation. We've obtained the transcripts of those interviews. Here, a healthcare assistant describes how he guided Robert and Linda into that corridor.
They were standing and I said, let me go and get him. He's in his room. That is when I went to his room. I opened his room and couldn't find him.
As his parents stand in the corridor, staff begin searching for Richard. But instead of immediately checking the bath and shower room next to his bedroom, which staff had earlier unlocked for him to use, the search begins at the other end of the ward.
It was only after some time of coming down, walking out, coming down and starting the search that there was then a shout of, he's in the bathroom. Bearing in mind that the damage that took Richard's life takes no more than about 6 minutes for that damage to accumulate, we're talking about that 6 minutes, or the best part of it, in this period here.
The healthcare assistant and a support worker reach the locked bathroom door together. The support worker pulls her personal alarm, signalling there's an emergency. At the sound of the alarm, many other staff come running, including a nurse.
I went to run up there and I saw two of my colleagues coming back and I went, is it a mistake? And they went, no, it's up in the shower room. I could not understand why they were going that way. I went to pull the door. It was locked. Locked.
I would have expected people to have stations, that have had responsibilities and to know what they were and where they should be and what it is they should be doing. I didn't see that.
It was just pandemonium, and there was just no one taking charge of anything.
Yeah.
The healthcare assistant says he found Richard and remained with him until help arrived. The nurse says after responding to the alarm, she found Richard behind a locked door.
I was still there when the staff arrived. I'm definitely sure I was there. We were there when other people arrived, and we did not lock the door again.
I just know I had to unlock that shower door, and that haunts me to this day. Why would anybody leave him? Why was the door locked? Why were people walking down the opposite direction while I was running up?
The Trust's serious incident investigator concluded he was unable to clarify with certainty the exact events of Richard Wade's discovery because the investigation has been hindered by staff's ability to recall events.
Time wasted, critical time wasted. And it's that time in that period between when Richard attached the ligature, which could only have been some 20 minutes before at the outside for him to be resuscitated, to the point of our arrival. Every moment in that time was critical, and yet there was no process and no effective practice.
As Robert and Linda began to piece together what led to the discovery of their son in this bathroom, more worrying failings emerged. The staff weren't aware of just how ill Richard was, so they'd allowed him to keep his dressing gown cord. He used it to take his life.
I just packed his bag and I thought he loves his dressing gown. I know that but I'll put that in, that'll make him feel comfortable. And I remember thinking, shall I take the dressing gown cord out? And I thought, no, it's okay, they'll remove it. To this day, I obviously think, why didn't I take it out?
North Essex Partnership Trust, which ran the Linden Centre, merged to form Essex Partnership Trust last year. They told us the former trust made admissions in regards to the failings in Richard's care, accepting that without them, Richard would not have died when he did. The new trust says it's strengthened its search policy as continuously improving patient safety is its top priority. In a narrative verdict in May last year, an inquest jury found the state failed to protect Richard because Richard's risk of suicide was not properly assessed. It is a view echoed in the transcripts of the staff who were interviewed.
Bloody rope should not have been given to him. We did not know enough. I'm just so angry that the facts were not there. This could have been avoidable.
It's the worst thing, I think, a mother, a parent can go through. Inside, there's like a deadness. I don't know how to explain it, except that you know something is missing and will always be missing.
But Linda and Robert still hope that somehow they'll learn the complete truth about Richard's death.
I miss his humour. I miss his intelligence. I miss his humanity. Most of all, I just miss a damn good friend. He's gone. He's not coming back. But if anything comes out of this, to my mind, it's not a matter of retribution. That has nothing to do with it. Getting things right so that no one else has to sit and go through what we've been through as a family.